Good morning, good afternoon, good evening from wherever you are joining us in the world. I am particularly excited and honored to be a part of this wonderful launch today. This textbook entitled Foundations of Global Health and Human Rights. This textbook I wish was there when I was a medical student in my early years of my career. My name is Dr. Tlaleng Mofokeng, and I am a medical doctor working and living in South Africa. I'm also a commissioner at the Commission for Gender Equality and National Human Rights Institution in South Africa. And recently, I have been appointed the United Nations Special Rapporteur on the Right to Health. And I know firsthand the importance of having resources as a young person, as a young medic, as a young expert in the field of human rights, that is a guiding resource, and that is a resource that can really lay the foundation as human rights defender, but also as clinicians. I didn't learn early on in my, undergraduate training about the importance of integrating and operationalizing human rights into clinical care. And it's only later on in my clinical years as a young intern, as a young community service doctor, that I really was confronted firsthand with some of the health determinants and some of the societal and socioeconomic issues that impact my patients' right to health, but also that impact their health outcomes. And today it's an absolute honor to be able to welcome you and join in celebration with you all. And congratulations to Larry as well as Ben and all of the contributing authors to this wonderful foundational textbook. The time is now, the moment is now, the future is the present. And I cannot think of a more important time to be launching this wonderful book. And it's my wish and it's my vision that this book forms the foundational text for a lot of my colleagues and my peers in the medical fraternity as we learn clinical medicine to also understand how, in our practice of medicine, in our clinical care, we can firstly promote as well as defend the rights of everyone to the highest attainable standard of both physical and mental health. And thank you very much for including me in this wonderful celebration. And I hope you have a wonderful, wonderful International Human Rights Day, the 10th of December, amid a COVID-19 pandemic, which has brought, immense challenges for all of us globally, but also has with it some amazing, amazing opportunities to firstly collaborate and really work in partnership with each other across the globe, across the thematic areas. And again, congratulations, colleague. I, as a special rapporteur on the right to health, look forward to drawing on your insights and from your learning and really using this amazing textbook as a resource, first for my work, but also to amplify the work and your work over the years as someone who is coming into this new mandate. And it's my vision for my tenure to really focus on the restoration of dignity of all people. And this book is one step and is one important resource in ensuring that I succeed in my tenure. Again, congratulations and thank you very much, and enjoy the rest of this wonderful launch.
Uh, Good morning, good afternoon, good evening, wherever you are in the world. I'm Larry Gostin. I joined with my wonderful colleague, Ben Meyer, to edit this book, and I had a great privilege to do that. I'm at the O'Neill Institute for National and Global Health Law at Georgetown University and director of the WHO Collaborating Center by that same name. Thanks so much for joining us. This is a wonderful day for us, not just because of the launch of our book, but of course, we're joining on Human Rights Day, the anniversary of the signing of the Universal Declaration of Human Rights, and to celebrate the publication of the book by Oxford University Press, Foundations of Global Health and Human Rights. Human rights are essential to global health. I think we've always known this, but we know it more now than we ever have in our modern history as we're experiencing the COVID pandemic with all of its potential for removing the human rights of ordinary people in every continent in the world. The field of health and human rights has a rich history, beginning with Jonathan Mann, and it's proven increasingly important both in local action, national action in global contexts. Rising originally out of the advocacy in the early AIDS response, the rhetoric of human rights has long been central to public health engagement. But professionals from all fields, and all of our fields are very different, have to understand, have to operationalize the legal obligations of human rights for public health. That is, it's a powerful language, human rights, but it's also a powerful obligation, an international and national obligation under law. This textbook is intended to support teaching on global health and human rights, and it arose out of our previous Oxford University Press volume that Ben and I developed on human rights and global health, the rights-based governance in a globalizing world. We compared the strategies developed by international organizations to advance human rights for global health in that book. And through that book, it became clear that there was no standard educational reference to support the practice of human rights in global health. And with the imperative for the education in the field, academics through many disciplines have sought to teach the subject in schools of law, medicine, public health, nursing, social work, international relations, and global studies. But there's never before existed a foundational textbook to support student education in the field. We're seeing rising challenges in an increasingly divided world. Ben and I felt that it was important to develop a textbook, not just because we want to empower our own generation, but more importantly, we wanted to empower a new generation, a new young leadership to sustain the global commitment to universal rights in global public health. And looking to that next generation, they will face many struggles ahead. Our book, Foundations of Global Health and Human Rights, with just an incredible world-class group of scholars and advocates as authors in that text. They provide a detailed understanding of the complex relationship between global health and human rights. And in preparing for the next generation to meet the increasing challenges in global health and human rights knowledge, it will be crucial to influence health policy, research, and advocacy, securing a future of global health with justice. And if there were one lesson from our book and one mantra that we want to pass on to the next generation, is to achieve a world of global health and equitable, just solutions to global health. Thank you very much, and I'll be back to you later with chapter 2.
Thank you, Larry, for leading the field of health and human rights over these many decades and conceptualizing this foundational text to support human rights education for global health advancement for the next generation. Joining Larry in editing this foundational text, my name is Benjamin Meyer, and in building from the evolving linkages between global health and human rights, this volume looks to the role of human rights under international law as a basis for public health, providing a foundation for understanding the global standards by which to frame individual rights and government responsibilities for health. As recognized by WHO Director General Tedros in his foreword to this textbook, it's crucial that students understand these foundations as a basis for future practice. And I'm delighted that Director General Tedros is able to speak with us briefly today.
It's an honor to address you on the occasion of the International Human Rights Day and the launch of Foundations of Global Health and Human Rights, edited by Larry Gostin and Benjamin Mason Meyer. In 1948, as the world sought to rebuild from the horrors of the Second World War, two documents came into force that have shaped the health of the world's people for more than 70 years. One was the Universal Declaration of Human Rights. The other was the Constitution of the World Health Organization. Both affirm that health is a fundamental human right, not a privilege for those who can afford it. This year's theme for International Human Rights Day is Recover Better, Stand Up for Human Rights. It's a reminder that human rights, including the right to health, must be at the heart of our response to COVID-19, the global recovery, and our efforts to accelerate progress towards the Sustainable Development Goals. Congratulations to Larry and Ben on this very important new publication. My hope is that it will help to make human rights more than a slogan, but a reality in national and international law and policy, and in the lives of the world's people. I thank you.
In making human rights a reality, and in introducing the flow of our discussions today, the field of health and human rights seeks to apply human rights under international law to advance the public's health with this textbook on foundations of global health and human rights, looking across the field to support the next generation of scholarship and advocacy. Those of us in this interdisciplinary field bear witness to the ways in which international human rights standards can influence policies, programs, and practices, and bring about meaningful change in people's lives, elevating health concerns in domestic and global policies, integrating legal norms in public health practice, and facilitating accountability for realizing the highest attainable standard of health. Yet to realize human rights in public health into the future, it would be necessary to accelerate health and human rights education, as Larry said. Drawing from the growing literature in the field, we set out to create a book that could provide a foundation in education for health and human rights, with chapters developed specifically with an educational purpose, case studies to clarify principles, and questions for student consideration. As Larry and I began to plan for this educational book, it became clear that the growing field of health and human rights had fostered a generation of thought leaders. And I'm so inspired that we were able to bring the field together. 38 scholars and advocates, all in this book, drawing on their collective expertise to shape the development, the implementation, and the application of human rights in global health for the next generation. Bringing together these contributions, our textbook on foundations of global health and human rights is organized in 4 main sections. In the opening section, we seek to provide students of the field with an understanding of the development of human rights norms and principles that frame global health, introducing the right to health and the wide range of human rights that impact on public health. Beyond the development of human rights under international law, Section 2 seeks to frame the implementation of human rights in health policy and public health practice, seeking to understand how international human rights law is translated into meaningful change in individual lives. With this understanding of the development and the implementation of human rights to advance public health, we look across 10 chapters to examine the application of human rights to contemporary public health threats and analyze the rising human rights challenges of a rapidly globalizing world, exploring the collection of core global health topics that we'll discuss today. This volume addresses varied topics, but it's intended to be read as a single educational text, with each chapter designed to build from the one before it, while adding new information to the reader's understanding of the field. This book is a journey to understand the field of health and human rights, and we begin that journey today in Section 1, which introduces the reader to the normative foundations and legal principles for understanding the role of human rights in protecting and promoting health. The first chapter, which Larry and I developed alongside Therese Murphy, provides a historical narrative of human rights leading up to the 1948 Universal Declaration of Human Rights. And as this young scholar here explains, the opening chapter of Foundations of Global Health and Human Rights traces the historical evolution of rights leading up to the modern conceptualization of human rights under international law as a basis for public health. It's this history, these normative foundations that have shaped the present movement for health and human rights. And to help us understand government obligations to realize human rights for global health, it's necessary to appreciate the centuries of struggle to realize rights that led to the post-war conceptualization of human rights under international law, leading to this codification of human rights under international law. The idea of rights has evolved throughout history through religious proclamations, philosophical reasoning, and rights-based revolutions. And these early parts of our chapter trace the birth and the development of human rights with the notion of natural rights forged across centuries and over the course of history. Yet where these moral claims failed to protect public health, the atrocities of World War II shaped the current international human rights system, with the post-war creation of the United Nations giving birth to the notion of human rights under international law. This imperative for human rights law would form the basis in the aftermath of World War II for health obligations to be proclaimed globally under the Universal Declaration of Human Rights. Now let me turn it over to Therese Murphy to tell you about the influence of the UDHR in the development of human rights to promote health.
As we know, histories of human rights are a live issue at present, and rightly so, especially, of course, on a day like today, Human Rights Day. We believe that the Universal Declaration of Human Rights, which dates from December the 10th of 1948, ought to be a fuller part of human rights history, and in particular, of health and human rights history. We would like students of human rights history to consider if we were right in the chapter to describe the Universal Declaration as the quiet pioneer of human rights law. We described the Universal Declaration in that way for two reasons. First, because it has often been eclipsed by the two international human rights covenants with which it forms the International Bill of Rights. And second, because its influence, the influence of the Universal Declaration of Human Rights, remains underexplored. Too often, there are simply superficial references to it as the constitution or starting point of the human rights movement. We need to understand its power and influence, not simply invoke those things. So what we want, what we need within health and human rights are histories of the Universal Declaration as a living text, as a text that has grown in authority, as a text that has traveled around the world and been translated into local bills of rights, into policies, and into practices at government level and at local level, inside clinics, hospitals, health centers, individual health professional practices, and by individual people, patients and others, and by organized groups. We need these histories to spur us to think about our health and human rights past and about our future.
And so, following from the birth of the United Nations and this living document of the Universal Declaration of Human Rights, Chapter 2 introduces the legal foundations of the book and the field, laying out the role of human rights under international law. And I welcome Larry back now to share how this chapter defines human rights as part of global health law. Larry?
Thank you very much, Ben. Human rights offers an international legal foundation for social justice and public health. I've always thought that social justice is at the heart of public health, and human rights law is all about equity and health. Central to international law, international human rights law proclaims the basic rights and fundamental freedoms to which all human beings are entitled simply by their birth. International human rights law is binding on governments, and governments are obliged to realize those rights to promote the health of the population. International legal rights structures do offer these obligations on states to realize health-related human rights. And at the same time, they enable rights holders to seek redress and to facilitate legal accountability for justice in global health. This conceptualization of international human rights law first emerged after World War II, codifying the basic rights and fundamental freedoms to which all human beings are entitled, and placing legally binding obligations on governments across the world, all governments. Building from the Universal Declaration of Human Rights that Ben and Therese just introduced, the evolution of international human rights law over the past 72 years has come to impact public health through an expansive and reinforcing set of international legal standards. And thank you, Ben, for joining me in this effort, and I will then turn it back over to you.
Thank you so much, Larry. By examining this translation of the UDHR into binding international legal standards for global health promotion, we begin to understand for the first time health as a human right. And in focusing on the right to health, we bring in the first of our contributing authors for the first time to introduce the right to health and other health-related human rights, encompassing a wide range of determinants of health.
My name's Damon Barrett, and on behalf of myself and my co-author, John Tobin, I'm delighted to have been asked to be part of this really foundational textbook. It's an honor to be in the company of so many wonderful scholars and practitioners. So thanks to Ben and Larry for the invitation, and to John for the invitation as well to join him in this chapter. Now, the right to health is not the only human right relevant to health and public health, but it is a central one. So our chapter essentially deals with the question of what the right to health means. To say the right, people have the right to the highest attainable standard of health doesn't tell us very much on its own. And there's much criticism of the right to health for being somewhat vague. But over the years, over the decades, in fact, there has been considerable interpretive work done. And our chapter fleshes out this core content of the right to health and its well accepted obligations that it places on states, but also some of the more contested obligations that remain there. And this gives students still a lot of work to do on fleshing out those norms. We also look at some controversies, including the relationship between autonomy and individual liberty and public health goals. And we look at some maybe more overlooked determinants of health and what these mean for the right to health, or vice versa, what the right to health means for them, including commercial determinants and privatization of healthcare, and legal determinants. And we've looked at the example of responses to illicit drugs and how the right to health has informed harm reduction responses. I can say that I'm already using this book in teaching here at the School of Public Health and Community Medicine at the University of Gothenburg. I just find it really pedagogical. I think the structure that Larry and Ben have put together is really helpful for teachers like myself. From the discursive text boxes, which I've used to craft seminar discussions and so on, to the questions at the end of each chapter, from which we can craft assignments, we can craft discussions and so on, but also just the progression through the book itself. It's really well put together. And so congratulations, Ben and Larry, on the launch of the book. And thanks again from myself and John for inviting us to be a part of it.
And thank you. Building from this focus on the right to health, section 1 ends in chapter 4, focusing on the normative development of human rights by looking to cross-cutting human rights principles that structure the rights-based approach to health. And now I turn to Flavio Bustreo, joining us in person, to speak about these rights-based principles.
Thank you very much, Benjamin and Larry. And let me join the enthusiasm in this virtual room for the launching of the book. And at the onset of my short remarks, let me thank the students with whom my co-author, Professor Dobler, and I have had intensive discussion, and upon which we have tried to write the chapter, and especially Miss Cecilia Rocco. At the time we started the chapter, a recent graduate from Italy, and many students from Makeni University in Sierra Leone. Our chapter, as you can see, is entitled The Rights-Based Approach to Health. And it is explaining why, when dealing with global health, is not enough to only focus on the entitlement provided by the right to health, but also look at what we call the founding principle. So the rights-based approach, you can think about it as a strategy that enables countries and governments and actors to reach health outcomes by using and being grounded on human rights principles. This conceptualization came a little bit later than what you heard in the previous chapters, and it really begins clarifying itself in the 90s on the tail end of the right-based approach to development, and really is launched and is being born with the thinking of Jonathan Mann at the time of the AIDS, the first public health response to AIDS, which was characterized by stigma, discrimination, and use of coercive public health tools. So the scholarship crystallized then the rights-based approach, including 4 key principles that are essential for driving this strategy of reaching health outcome using a human rights-based approach. Those principles include participation, and in a chapter, we give examples of how important it currently is, for example, people and young people participation in the development of policies and programs in health. The second principle of the rights-based approach is also accountability, which is so crucial for enabling redress and allowing civil society organizations to speak up and to be very, very clear. The third principle concerns transparency. I think never like currently could we understand how important it is that policies and programs are developed to address health, such as in the current pandemic, in a transparent way, so that decisions, for example, about future use of the vaccine are done in a clear and transparent way. And the final principle, not the final, but the critical principle, is also equality and non-discrimination. Because let's not forget that human rights, including the right to health, apply to all individuals without discrimination, without taking into account which of the socioeconomic quintile those individuals come from, without taking into account their gender, their ethnic origin. So these are critical principles that I'm sure the students and the scholars learning from the book will appreciate how important they are and how current they are. And let me conclude by saying that today, on International Human Rights Day, it's very clear we have a demonstration by the current pandemic of how much human rights are interdependable and indivisive. And like never before, any other human rights can be achieved unless we achieve the right to health.
Thank you so much, Flavia, for your scholarship and for your leadership in advancing human rights and global health. Shifting now from the development of human rights to the implementation of those rights to advance health. Section 2 surveys mechanisms for implementing human rights in national efforts and facilitating accountability for health and human rights. We begin in Chapter 5 by discussing the importance of translating international law into domestic policy, and welcome Gillian McNaughton to introduce you to this implementation process. Gillian.
Thank you, Ben. Foundations of Global Health and Human Rights is really an excellent new volume, and I'm using it this semester in my interdisciplinary graduate course on global health and human rights at the University of Massachusetts, Boston. The chapter Translating International Law into Domestic Law, Policy and Practice, which I co-authored with Angela Duger, provides an overview of the mechanisms through which international human rights law is internalized or translated into domestic law, policy, and practice. International human rights law is largely state-centered, meaning that it relies on national and subnational governments to implement it, to promote and protect human rights, and to provide remedies to victims of human rights violations. For this reason, it's important for public health scholars and practitioners, as well as others interested in promoting health rights, to consider how international human rights law is translated into domestic law, policy, and practice. For several decades after the UN was established in 1945, the organization and its members states focused their human rights efforts on developing human rights declarations, treaties, and institutions. In recent decades, however, there's been a shift from defining and conceptualizing human rights in international law toward implementing human rights on the ground and making them real in people's lives. International declarations, treaties, and mechanisms are essential foundations of the modern human rights system. But we also need to operationalize these rights in countries and communities in order to improve health and well-being. Our chapter is divided into 3 parts. Part 1 considers international legal obligations of governments to implement human rights at the domestic level. It then explains 4 approaches to do so, through human rights education, policymaking, judicial and quasi-judicial enforcement, and international processes. Part 2 examines how national governments and subnational governments use these approaches to translate international human rights law into the domestic sphere. And Part 3 looks at the crucial role of NGOs and how they engage these approaches to translate international human rights law into practical efforts at the local, national, and international levels. And the chapter concludes that public health actors must understand these complex processes of domestic implementation of international law in order to entrench health rights and build a domestic culture favorable to health and human rights. Thank you.
Thank you, Julie, and for introducing us to the importance of understanding the need to bring human rights home. Now, as we begin to recognize the importance of human rights implementation, we look to human rights advocacy in the domestic implementation of rights. And let me turn now to Joe Amen, who draws on his academic research and his human rights advocacy to examine the range of advocacy tools that have been used to advance human rights in global health. Joe? Mute.
Sorry, once again, thank you, Ben, and thank you, Larry, for your leadership on this volume, this important work. I think it's a great honor and pleasure to be here with all of these people who are really leading the development of this field. And with my co-author, Eric Friedman, it was a lot of fun working on this chapter on advocacy. And to be honest, 2020 has showed us that this is a year that has demanded human rights-based global health advocacy, not only for the COVID pandemic and the response to it and the failure to respond to it by many governments, but also because of the importance of responding to racism and other systems of oppression, to overturn the vast wealth inequities that exist in this world, and ensure that human rights are at the center of how we address public health challenges and ensure that people have the right to have the highest attainable standard of health. So this chapter, like many of the other chapters, references the foundational HIV movement, which was galvanized by activists and advocacy and demands that the right to HIV prevention and treatment are respected by governments, that governments can't simply choose that they don't wish to engage or respond to the HIV epidemic because of ideology or because of discrimination or other factors. But what I think is interesting is that it goes on in the chapter from that to look at vast numbers of other health issues. And in my work and in my experience, I've had public health people say to me often that we need more attention to human rights on issues like TB, like neglected tropical diseases or other issues. But sometimes when I ask them why they see that as important, they refer to one aspect of the HIV movement, and that is that human rights advocacy was able to galvanize more funding for the response. And that is the wrong message. Human rights advocacy demands that those who are affected be involved in every part of the response, that governments cannot take repressive approaches to not put in place evidence-based responses. It demands that there's dignity, that there's a right to information, to be free from discrimination, from violence, and from arbitrary detention. And the chapter outlines fundamental steps to conducting human rights advocacy. I worked as an advocate for a long time with Human Rights Watch, and these were the sort of steps that were distilled in our approach at Human Rights Watch. Documenting abuses and raising awareness of an issue, putting an issue that's been neglected, that hasn't gotten attention from governments on the stage, whether that's palliative care and access to pain medicines in certain countries, whether that's aspects of sexual reproductive health and rights. The next big section is on building coalitions and engaging communities. Nothing goes forward without the support of communities, without the engagement, without people working together for change. And then the final step that we talk about is the process of reforming laws and policies and practices, enforcement, engaging government officials and other actors directly, quietly, loudly, in the streets, in boardrooms, in conference rooms, providing model laws, all strategic litigation, all of these different steps are part of the process of doing advocacy. Finally, the chapter talks about new partnerships and new approaches to advocacy and partnerships between NGOs and academic communities, recognizing the need for bringing in more diverse actors who haven't necessarily identified themselves as working in a human rights frame, and being intersectional between those communities to find the points of agreement and common understanding and direction. And then finally, we also talk about using digital health technologies to demand accountability, which is really the fundamental part of human rights advocacy. So I find this chapter a distillation of a lot of my work, and I find it within the context of the book to be incredibly helpful for the students that I have And I hope that all of you listening will be able to find that same interesting ways to advance it and to motivate the next generation of activists and of scholars in this field. Thank you.
Thank you so much, Joe, for introducing the innovative strategies for advocacy that you've developed over the years to facilitate accountability for neglected public health issues. Building from this focus on advocacy, we then look to monitoring and review as a complementary basis of human rights accountability in global health. Returning to this awkward video presenter and his far better co-authors, Hannah Hufstetler and Judith Bueno de Mesquita. Chapter 7 discusses the role of monitoring and review mechanisms as a foundation for accountability to ensure human rights implementation to promote global health. Accountability for the implementation of health-related human rights requires an independent means to assess compliance with international human rights standards. How do we know that state ratification of human rights treaties leads to meaningful human rights implementation, leads to meaningful impacts on individual lives? In order to facilitate accountability for human rights implementation, we need monitoring and review mechanisms to provide external oversight of national efforts to promote health and human rights. Now let me turn it over to Hannah Hufstetler to tell you more about the evolution of this interconnected ecosystem of monitoring and review at national, regional, and international levels.
So there's no single centralized body or system for human rights monitoring and review. Instead, and the point we make in the chapter is that oversight for human rights implementation is really structured and reinforced through a range of interconnected mechanisms that exist across multiple levels of governance. These different mechanisms form what we conceptualize in the chapter as an ecosystem of monitoring and review. Each level of this ecosystem existing at national, regional, and international levels employs complementary structures and methods to not only assess state efforts to advance human rights, but also consider complaints of human rights violations, to make recommendations on how to improve implementation, as well as clarify treaty provisions for states. So at the national level, these mechanisms include bodies like national human rights institutions, which are given the authority to review government actions and make recommendations to ensure that the state is meeting their human rights obligations under international law. At the regional level, mechanisms which are established through regional intergovernmental organizations like the African Union, for example, include regional human rights commissions, which monitor regional human rights treaties and provide some oversight where domestic monitoring and review might fall short. And lastly, at the international level, mechanisms to monitor and review human rights are facilitated through the United Nations. These include the UN human rights treaty bodies, which oversee the implementation of specific international human rights treaties. This also includes special procedures focused either on the human rights situations of particular countries or specific human rights issues, such as the Special Rapporteur on the Right to Health. And it also includes the Universal Periodic Review, which I will hand it over to Professor Bueno de Mesquita to talk about.
The Universal Periodic Review was launched by the UN Human Rights Council in 2008. It's a peer review procedure, which means that states assess and make recommendations to each other, reviewing the human rights situation in all states every 4 to 5 years. The procedure is really critical because it's the only one within the UN which holds all states to account for all human rights. So some of the other procedures which Hannah was just referring to, they either have more limited engagement by states or cover only selected rights. So with so many rights to review, how much attention does the procedure give to the right to health? Well, the good news is that our chapter highlights that in its first 2 cycles, the Universal Periodic Review gave a great deal of attention to the right to health, with respectively 22% and 25% of its recommendations having a health focus. This is a really significant number and illustrates the relevance of the procedure for the right to health, as it provides a prominent forum to enhance state accountability for and also provide guidance through its recommendations to states on how they can comply with international human rights law. Yet the procedure is not without fault, and our research found that the recommendations were framed too generally. They didn't provide very precise guidance about what was expected of states. Moreover, recommendations have tended to be clustered around prominent and well-known health and human rights issues, such as maternal and child health, while paying very little attention to other critical issues like mental health. The work provides analysis that can help, our research provides analysis that can help shape the UPR as it continues through its third cycle and beyond.
And so as we facilitate accountability for human rights in global health, we've looked to advocacy and to monitoring, and Chapter 8 looks to complementary judicial efforts to provide accountability for health-related human rights. With Colleen Flood joining us today to analyze the opportunities and the limitations of litigation-driven efforts to enforce human rights for global health advancement. Colleen?
Oh, thank you so much, Benjamin, and thanks to everyone. It's so wonderful to see you all and to be talking on this important topic, especially as we're in the middle of the COVID pandemic. And I really hope that you and your families are healthy and are weathering this storm and these incredibly challenging times. So first, I'd like just to give my very warm thanks on behalf of myself and my colleague, Brian Thomas, to you, Ben, and to Larry for the work you've done in creating the book. And I think it's a tremendous resource in so many ways. And we were just delighted to contribute this Chapter 8 about litigation of human rights for health. So just very briefly, what we did was lay out some of the history of the historical origins of the right to health, but included within that rights that more indirectly speak to health, such as a healthy environment and the right to education. And then we explored litigation of those rights across time and space in a number of jurisdictions. And we certainly believe that there's a huge prospect, a great prospect for litigation of health human rights to be an important mode of accountability to realize, an important mode of accountability to hold government's feet to the fire, to realize the right to health, and thus, I think, the ultimate flourishing of each of us as individuals, as nation states, and as a global community. Still in all, litigation is a very human institution. And as such, things have not always gone as smoothly as we would like towards realizing this goal that we have for litigation of health human rights. To individualized a conception of a right to health enables the right to health and the litigation thereof to be co-opted by corporate interests or the relatively wealthy. And in some states, we've seen that with very high rates of health rights litigation, that even the very sustainability and certainly solidarity within public healthcare systems can be undermined. And sometimes too, even in my own home country of Canada, health rights litigation has been used by some to try to privatize the public healthcare system. I'm happy to report we're fending that off so far, but it is a risk. And still, though, when we've seen some incredible examples of health human rights litigation, like the Treatment Action Campaign case in South Africa, and that case alone, ensuring access to Nepriven to prevent mother-to-child transmission of HIV has saved millions, hundreds of thousands, if not millions of lives. I think keeping those cases in mind is incredibly important as we assess the sort of costs and benefits of litigating health and human rights. So I think that jurists, what we try to point out is that jurists can best achieve the best potential from litigation of health human rights if they keep their eye on the ball of the goal of accountability, which I think is the goal that both Larry and Ben really try to weave through this entire book. And that accountability mechanism requires then that courts should demand of governments that they are, that their decisions are intelligible, that they're rational, and that they're transparent. And that over time, if courts demand that of nation states, that we will see better and more increasing realization of the right to health. And so this is not to overstep their institutional shoes. So courts shouldn't go into the actual decisions so much of resource allocation and priority setting. That is the responsibility of government, but for courts to respectfully demand a level of accountability for those decisions. So that's the sum of our chapter. And I really just want to thank you again so much, Larry. Larry, you know, for me personally, over the years, you've been such a great mentor and friend, and I want to thank you from the bottom of my heart. And it's been totally wonderful to get to know you, Ben, through the process of writing this book, and your diligence as a great editor and holding our feet to the fire on what we were producing has, I think, resulted in the chapter being much, much better for it. So thank you to both of you. And I look forward to reading and enjoying this book in the years to come.
And thank you for introducing students to these crucial litigation tools that have been used so forcefully to change impacts on health throughout the world. As many of our speakers have noted in focusing on the World Health Organization, global governance has become central to human rights implementation throughout the world. And Larry and I conclude section 2 by focusing on global health governance, drawing on our 2018 volume on human rights and global health to examine the mainstreaming of human rights across the United Nations and the work of international organizations to implement human rights in their policies, their programs, and their practices, beginning in the World Health Organization, but looking across the wide range of international organizations that impact on determinants of health. Given the rapidly increasing number of international organizations addressing public health, global governance has become a central basis to realize human rights in global health. To that end, these global governance institutions have integrated human rights into their organizational efforts, accepting international legal obligations as a framework for their global health policies and programs. As human rights norms and principles are increasingly mainstreamed in global health governance, Larry and I argue that it's necessary to understand this shift in human rights obligations, from the obligations of states to the obligations of institutions, recognizing ongoing UN efforts to harmonize organizational approaches to human rights implementation. While I could go on, global governance is the passion of my life. In the interest of time, I will jump ahead and move us into section 3, which considers the application of human rights to advance disease prevention and health promotion, where the health and human rights movement arose out of the early years of the AIDS response, as both Laria and Flavia noted. We begin with Sharifa Sakalala and John Harrington, who examine the ways in which human rights have been applied to an increasing set of communicable disease threats. Considering the importance of human rights, especially now, as we see a shift toward global health security in the COVID-19 response.
To talk about chapter 10, which is the chapter on communicable diseases. Communicable or infectious diseases are spread across populations through physical contact with animals or people. There are 3 main approaches to addressing communicable diseases, as we discuss in this chapter: a public health approach, which is grounded in scientific and epidemiologic understanding of the disease and seeks to constrain diseases at the expense of individual rights. And this often allows compulsory screening, movement restrictions, and mandatory treatment. The AIDS epidemic in the early 1980s fundamentally changed this approach because it made it really clear that there were serious questions about the efficacy because people merely went underground. But additionally, it created coercive attempts across marginalized groups, leaving them more vulnerable to HIV/AIDS. And the third approach is the securitized approach, which John will talk about. We make two fundamental points about human rights being fundamental to the spread or to the containment of infectious diseases in this chapter. The first is that human rights approach is essential to protect vulnerable groups. And we see this in the way in which AIDS has, in which the COVID-19 crisis has disproportionately impacted on vulnerable groups, such as groups, Latinx groups, Black groups, and groups who are poor and the elderly, meaning that a human rights approach must be fundamental. The second is that it helps us to make the case for access to essential medicines. And we did this with the AIDS pandemic, but also later on for tuberculosis and malaria. And these arguments we are seeing again with the COVID-19 vaccine. And so they're really critical to the way in which we think about infectious disease.
As you said, there's a contest in this area of communicable diseases between a security frame and a human rights frame. A security frame, which is long established into the 19th century, prioritizes the interests of the nation. It focuses on borders. It focuses on excluding people from the territory as a whole or particular territories, puts a premium on coercion and force. A human rights approach, guided, for example, by the Syracuse Principles, places much greater emphasis, as we say in the chapter, on the rights of individuals, and also on the idea of proportionality. That is, that measures taken have to be based on solid science. So the AIDS pandemic is not the same as the COVID-19 pandemic, and therefore the human rights justifiable measures may be different. And that these measures are necessary and no more than necessary to combat the disease. The legal regime that we talk about, which has come into the news very much now with the COVID-19 pandemic, is the international health regulations of the World Health Organization, which were revised in 2005 to bring them up to date and to move away from this strong security frame and to include for the first time ideas of human rights that we've just mentioned, and this idea of proportionality. The COVID-19 pandemic has shown that human rights are important, that people have recourse to human rights when they want to talk about what's going on and to criticize it. So the principles that we set out in the chapter are very much relevant now, but we also make clear that this regime needs to reflect human rights even more strongly. The human rights need to have more teeth to be more enforceable. And a particular area of interest for us is the situation of countries and people in the global south, where states lack strong capacity in many cases to protect their people against infectious diseases. There are some mention of this in the international health regulations, but again, it's not enforceable and it's not well defined. And COVID-19 has made very clear that these obligations of solidarity need to be made stronger and more enforceable.
As we build from this present focus on communicable diseases, we at the same time see rising non-communicable diseases in a globalizing world. And Chapter 11 looks to efforts to implement human rights, to prevent and control tobacco use, and to focus on obesity-related disease.
My name is David Patterson, speaking also for Professor Bridget Tobes from the University of Groningen in the Netherlands. I would like to congratulate Larry Gostin and Ben Meyer for assembling such a comprehensive and rich collection of perspectives on global health and human rights. Bridget and I were delighted to be invited to contribute this chapter, which explores how human rights norms, principles, standards, and mechanisms can be applied to non-communicable diseases, or NCDs. This perspective is important because today, more than 7 in 10 deaths worldwide are related to NCDs, and more than 1/3 of these deaths can be considered as premature, which means they occur in people under the age of 70 years of age. This is not only a rich world problem. Over 85% of these premature deaths occur in low and middle income countries. NCDs are increasingly perceived as a human rights issue because they are largely due to preventable risk factors related to tobacco consumption, the harmful use of alcohol, unhealthy diets, and a lack of physical activity. State obligations arise because these risk factors are largely within state influence or control. The chapter is divided into 3 parts. Part 1 addresses the history and current trends in the NCD pandemic. It focuses on the major risk factors of tobacco consumption and unhealthy diets. This part also notes the evolving legal and policy responses to these health threats within a human rights framework. Part 2 outlines the current human rights approaches to respecting, protecting, and fulfilling rights in NCD prevention and control. Most importantly, it recognizes the importance of the right to health in facilitating corporate accountability for the so-called commercial determinants of health. We discussed the examples of tobacco corporations appropriating human rights language to undermine health regulations in the Americas, and beverage corporations taking legal action to limit civil society campaigns to reduce sugary drink consumption in Colombia. Part 3 suggests opportunities to strengthen the legal obligations of states to respond to NCDs. It notes new sources of international law, including proposals for new treaties, such as on business and human rights, and the evolution of soft law in this field. This part also examines the interaction of international trade law and NCDs, and we discuss how one country, Samoa, ran foul of WTO rules when it tried to limit the importation of high-fat foods. This chapter concludes that overall, human rights standards provide a strong framework for addressing the commercial determinants of health in preventing NCDs. In the 21st century, human rights have become more important than ever in promoting global health. This is equally true in the case of NCDs, and we hope that this chapter will inform and inspire students in this field.
Excited to learn about some of these communicable and non-communicable disease threats. Chapter 12 examines the conceptualization of new human rights to account for these evolving understandings of public health and human dignity, looking to the example of the newly declared human rights to water and sanitation, and working with Inga Winkler, the director of the Human Rights Center at Columbia, to examine how the development and implementation of these rights have supported efforts to advance water, sanitation, and hygiene to promote public health. Shifting away from my chapters and back to some of our contributors though. Having launched chapter 13 last week on the International Day of Persons with Disabilities, I'm delighted to bring back Oliver Lewis to speak about the role of a key human rights treaty in shifting disability and mental health policy from institutionalization to community-based rehabilitation.
I had the privilege of co-authoring the chapter on mental health and disability with my friend and colleague Sumitra Patare. In the chapter, we make the point that the 2006 UN Convention on the Rights of Persons with Disabilities is the culmination of centuries of inequality, segregation, torture, and indeed murder of people with disabilities, in particular those with psychosocial or intellectual disabilities. And at the UN level, there have been many stops and starts from the 1970s onwards that have given rise to some limited rights of persons with disabilities. The CRPD contains innovations not seen in international human rights before, such as national monitoring mechanisms, an intersectional approach, and a duty on the state to ensure that participation of people with disabilities in the development of laws and policies that affect them. And while those elements are new, actually the CRPD is an example of evolution rather than revolution. And the framing of the CRPD as the latest iteration within an ongoing discussion means that the net effect of the CRPD is likely to land better at the policy level. The heavy lifting at the conceptual level is one of the challenges to implementation, in particular in the sometimes fraught field of mental health. But we take comfort from the fact that the civil society input into the 4 years that it took to negotiate the convention has given rise to a sustained activism around the world, with people with disabilities and their representative organisations demanding change at the local, national, regional and international levels. Thank you again, Larry and Ben, for this opportunity.
And Larry and I were delighted to take part in the launch of their chapter last week in the UK, and you can find that full launch online. Section 3 ends by reflecting on the indivisibility of human rights in addressing sexual and reproductive health, with Terry McGovern explaining the wide range of sexual and reproductive rights that have evolved in order to address issues of health equity.
I am really happy to be here. I want to begin by congratulating Professors Gostin and Mason-Meyer for this incredibly useful book. I've been teaching health and human rights on and off for many, many years, and this is exactly what we need so that we don't have to kind of scrounge around for so many materials. Just a bit on what the chapter is on. First of all, this chapter was written by me and Professor Aziza Ahmed at Northeastern. And I am just presenting for the two of us. Our core concept is, of course, that the fulfillment of sexual and reproductive health and rights is essential for the realization of global health equity and universal human rights. Our chapter actually examines the evolution of international human rights standards for health equity, focusing on SRHR, sexual reproductive health and rights, as a movement for realizing health and human rights. Part 1 is an overview of the evolving women's rights advocacy and international commitments that define sexual and reproductive health and rights. Part 2 focuses on key issues in the continuing development and national implementation of these rights. As sexual reproductive health and rights gets incorporated or not into development agendas, clarified by treaty bodies and expanded to include sexual, quote unquote, minorities. With the progressive trajectory of sexual and reproductive health and rights uncertain, Part 3 reflects on continuing challenges, including the ongoing criminalization of those who seek services and their providers, challenges posed by the rise of right-wing populism for feminist advocacy goals, and the pushback against lesbian, gay, bisexual, and transgender rights, given rising opposition to sexual rights, safe abortion, and sexuality education. This chapter concludes that creative advocacy will be required to respond to these struggles and advance sexual and reproductive health. Needless to say, we are hopeful that some of the damage that has been done by the Trump administration, including the global gag rule, the domestic gagging of Title X funding, the use of every opportunity in the multilateral space to chip away at sexual and reproductive health and rights. We're hoping that we'll see a change in the year to come. But nonetheless, these are recurring long-term struggles. So we hope that our chapter will help give students some of the basic history here. Thank you and congratulations.
We face a series of long-term struggles that have been exacerbated by a globalizing world. And our final section considers these pressing global issues at the forefront of health and human rights. We begin by addressing the connection between economic development and global health, analyzing the public health importance of the right to development and the rights-based approach to development.
I'm pleased to discuss Chapter 15, which Alice Han, a physician who focuses on violence against women and girls, and I, a human rights specialist, co-authored on health and human rights through development. Our chapter discusses the role of human rights in framing development to realize a healthier population through a rights-based approach to development and through the right to development.
I welcome this collaboration. It fuses our areas of expertise to produce the ideas in this chapter, which are crucial to understanding health and human rights. Human rights can frame the sustainable development necessary for global health and address economic development obstacles and unjust power distributions. The right to development can frame how international states and organizations allocate public goods for public health.
Thank you, Alice. This chapter brings out how human rights is used in public policy and civil society advocacy to advance the Sustainable Development Goals, the SDGs, and the right to development, as well as a rights-based approach to international development cooperation. We show the advances in placing human rights in the forefront of the SDGs while acknowledging the continuing reluctance on the part of governments to implement human rights in development cooperation and the impact of the rise of populism and nationalism. We conclude that despite obstacles, much has been achieved in development thinking through human rights, moving the world from a narrow understanding of development as growth toward a global commitment to sustainable human development, in which health and human rights are vital approaches to addressing the challenges of climate change, pandemic disease, poor governance, unjust power relations, and political inertia. And now I would like to give the final word to Alice.
Thank you, Steve. This chapter is essential to the foundations of global health. As an obstetrician and gynecologist, I am committed to gender equality and supporting women to obtain the highest standard of health and well-being. But having worked globally in both developed and developing countries, I've seen firsthand the detrimental impact on public health when human rights are absent from development policies. The challenges that lay ahead for global health governance will be to draw upon the progress made in developing and applying human rights indicators to facilitate rights-based accountability for the transformative potential of the Sustainable Development Goals. Development, health, and human rights share a commitment to promote human well-being. A foundation has been established with potential to realize the ultimate rationale of human rights, public health, and development. We leave it now in your hands to push forward to better the human condition.
As we push forward, grateful to our amazing research assistants for their video editing skills, we think about Chapter 16 extending this economic focus to the international trade system. And Shuangfang Wu explains the health and human rights impacts of the World Health Organization, especially the balance between intellectual property protections and health-related human rights that will be so crucial in ensuring equitable access to a COVID-19 vaccine.
Jianhui and I want to first congratulate Larry and Ben on this important book, which provides a detailed understanding of global health and human rights and the potential solutions to the challenges. This book is also important during this difficult time, when the COVID-19 pandemic is reframing global health governance. The chapter, International Trade, Public Health, and Human Rights, Jianhui and I wrote, aims to explore how to navigate health-related human rights in the trade and public health complex by tracing the intersection of international trade and public health, by examining the role of international trade in global health law, and by investigating possible venues to resolve the trade and public health tension in light of human rights. The tension between international trade, public health, and human rights has attracted lots of attention during the COVID-19 pandemic, especially when most countries worry that the protection of intellectual property rights stipulated in TRIPS and the TRIPS Plus may harm the public health of developing and the least developed countries and override the state's obligations to protect and fulfill the right to health, which entails providing for immunization and treatment against the major infectious diseases to all without discrimination. But as discussed in this chapter, a human rights approach which calls for an emphasis on the role of the state not only as negotiators of trade law and the setters of trade policy, but also as the primary duty bearer of the implementation of human rights, can be applied as an essential tool during this challenging time by exploring a various form of vulnerabilities exposed by strict intellectual property rules as accelerated by the pandemic, and to balance the conflict between public health and intellectual property. It is a great honor for me to work with Larry, Ben, and all the distinguished authors on this important project. I hope that we can win the battle against the COVID-19 in the near future and meet you all soon. Thank you.
We are grateful to Xuan Feng for his dedication to this chapter and grateful to his institution, Academia Sinica, which will be hosting a separate launch of this chapter in 10 days, and we hope to advertise that launch soon. As we shift forward to contemporary threats in the context of conflict and emergencies, Dabney Evans has led an effort to consider the desperately needed international efforts to protect health and human rights through international humanitarian law.
Happy Human Rights Day. My name is Dabney Evans, and I'm an associate professor in the Hubert Department of Global Health at the Rollins School of Public Health at Emory University. I want to begin by acknowledging my co-authors on our chapter, Laura Martin and Edward Queen. And I want to join you all with great excitement for the launch of this important text, Foundations for Global Health and Human Rights. I want to acknowledge Larry and Ben for their tremendous work and send my warmest congratulations to all the chapter authors. Health and Human Rights in Conflict and Emergencies, Chapter 17, explores the relationship between humanitarian and human rights law in safeguarding health and protecting rights. The chapter examines human rights violations and emergencies, discusses ways public health programs contribute to the realization of human rights, and outlines approaches to mitigate the health impact of complex humanitarian emergencies on affected populations. Where humanitarian law provides a certain set of protections under particular circumstances, and some might argue that human rights law is merely aspirational in times of conflict, we argue that human rights law in such times is critical. We need look no further than the current COVID-19 pandemic for examples of exactly why human rights protections are important within public health and humanitarian emergencies. Our chapter begins with an overview of the history and evolution of the humanitarian sector and its major actors, including the inclusion of human rights in health response. Next, we examine current programming standards and structures, including human rights protections. We present several case studies that examine past human rights abuses by aid workers, the pervasive issue of gender-based violence in emergencies, and the role health workers may play as human rights advocates. The chapter concludes by exploring humanitarian assistance challenges and the future of rights-based approaches that are grounded in the humanitarian development nexus. We hope you'll take a look at our chapter and enjoy.
Grateful for the opportunity to expand this field into international humanitarian law. We shift as we approach the end of the book to recognize the importance of human experimentation in global health, especially given the rise of transnational corporate research to develop pharmaceutical treatments, with Andy Constantine addressing the ethical challenges that have arisen to protect human rights in clinical trials.
Congratulations, Ben and Larry, for the launch of this fantastic book. It couldn't be a better time to discuss the different ways in which human rights can promote global health. In a world decimated by the COVID-19 pandemic, health research remains a primary and vital goal for global health and the development of vaccines and treatments for both communicable and non-communicable diseases. However, the Globalized Clinical Trials Enterprise raises important questions about protecting the rights of trial participants. Unequal power dynamics and imbalances between researchers and human subjects require steps to respect and protect human rights. This requires careful consideration of what social benefits the research can reasonably deliver and whether these benefits are adequate justification for exposing trial participants to risk in the name of global health. The clinical trials enterprise has expanded globally, with research developed and owned by companies and research institutions in wealthy countries, but conducted mainly with participants in low and middle income countries. These low and middle income countries commonly provide ready access to large pools of research subjects who have never received a particular drug and have, at least historically, a more permissive regulatory environment. Our chapter examines a human rights approach to human subjects research, providing a defined legal framework, a universally accepted set of rules, and language that is internationally recognized. My co-author, Roberto Andorno, and I offer a historical overview of the development of the discipline of research ethics, outlining the tensions between advancing science and protecting the rights of research subjects. To that end, we trace the development of key international guidance documents to provide oversight of clinical research. Assuring implementation of these international standards, we consider the degree to which host countries have implemented these core principles and the ongoing challenges to protecting human rights. With the impacts of health research continuing to evolve, we look toward the legal and ethical challenges facing the globalized clinical trials enterprise in the coming years, including implementation challenges under national law and clinical trials during times of public health emergency, which has become a very relevant issue in light of current events. There is no doubt that the ability of research involving human subjects to lead to medical breakthroughs and large profits provides tempting grounds for infringing human rights in clinical trials. With the rise of a globalized system of health research, this system has created incentives for the exploitation of research participants and the violation of human rights. Ultimately, maximizing the benefits and minimizing the harms of globalized clinical trials requires more than simply compliance with the principle of research ethics and human rights. It will require functional and responsive regulatory systems and an educated and empowered population, as well as real options for treatment and care. Thank you again, Larry and Ben, for inviting us, inviting Roberto and I to contribute to this fantastic book, and congratulations again for your launch.
In addressing the globalized health harms of climate change, which is affecting the health of the entire planet. You see it, right? And given the overlapping health harms to both individual health and planetary health, Alex Phelan has considered how human rights can respond to these cataclysmic environmental health challenges. Alex?
I am so very excited and honored to be here today in the company of so many distinguished scholars led by Larry and Ben. Today may be Human Rights Day, but yesterday the United Nations Environment Programme's 2020 Emissions Gap Report was released, with the world still on track for a temperature increase in excess of 3 degrees Celsius this century, well beyond the Paris Agreement's goal of limiting global heating well below 2 degrees Celsius and even 1.5 degrees Celsius targets. And therein lies the rub. Governments have failed to meet or set appropriate national emissions targets. However, mitigation is also not enough. Governments must be adapting to the climate reality we are living in now, particularly to protect the most vulnerable who are already disproportionately impacted by climate change. While it can be hard to picture in the midst of this pandemic, poor planetary health through air pollution, land use change, and climate change are the greatest threat to global health this century. From extreme temperatures and weather events to shifting burdens of infectious disease. This chapter explores the impact of these issues on a selection of human rights, including those explored in depth in previous chapters, like the right to health, as well as increasingly defined rights, such as the right to a healthy environment and the right to science. Building on previous chapters, this chapter notes that human rights law may be used through both litigation and advocacy to hold governments to account to address these issues. But as COVID-19 has demonstrated, complex, urgent global challenges require us to go beyond holding individual governments to account and require action from governments that may not provide avenues for redress. Climate change is a challenge of global distributive justice. As a result, human rights are a foundation to inform the imperative of international action. For students, I hope that the book and this chapter is the foundation for you to take your next steps from. It's critical that we build up and beyond anthropocentric concepts in our response to anthropogenic damage to our planetary health. I want to give a special thank you to Larry, who I am so fortunate to have had not only as my doctoral supervisor, but as a mentor with his unparalleled advocacy and commitment to global health justice. And I want to acknowledge all of Ben's incredible work and to echo Colleen for holding our feet to the fire to create such a synthesized and consistently structured text for students. Congratulations to you, Larry and Ben, and to all the other authors for this textbook.
And thank you, Alex. This moment, as chapter 19 highlights, has come in a moment of existential challenges. And we confront these challenges in our final chapter on populist nationalism. I turn it back to Larry at the end to discuss the rising threat of populist nationalism to human rights and global health, and the importance of health and human rights institutions in resisting this rising threat. Larry?
Well, thank you very much, Ben, and thank you, Alex, for that important alert to all of us and to the world about the existential threat of climate change and the climate crisis. You know, as we've discussed today, the world has come together in an unprecedented cooperation since the end of World War II and the Universal Declaration of Human Rights to defend the rights and freedoms of everyone on the planet. Yet, what we've all clearly seen, and even more so with COVID, is this current populist age threatens our global solidarity and our mutual obligations to one another, and raises major challenges for future progress in global health and human rights. And it reveals a world in which nationalism and extremism have been on the rise. These populist leaders have exploited the divisions in our societies. Populist parties have risen to power across the world by exploiting fear in immigration, the other, and stoking rises in my country first, and the rise of nationalism. Nationalism, of course, is the antithesis of global cooperation that human rights is founded upon. We all know, and many of us are delighted as I am, that one major populist will be gone soon. But the rise of populism will live on. Challenging the shared goals of global health and human rights, populism seeks to retrench nations and push us all inwards in a way that focuses only on ourselves, selfishness, not caring about the world. We see this now with vaccine nationalism and the hoarding of vaccines, and robbing the World Health Organization and Gavi of scarce vaccine doses for the COVAX facility. Populist nationalism rejects public health science, cooperation. It too easily infringes on human rights and undermines global institutions like the WHO and global governance itself. This nationalist populism seeks to undo so much of the wonderful progress we've made in the past 72 years, as nationalist leaders have relentlessly undermined global solidarity that's needed to respond to the common threat of COVID-19. It remains unclear how such opposition will impact the continuing evolution of human rights and public health, and it's our job to make sure that nationalist populism doesn't undo all of the gains that we've made. In this final chapter, we examine how advocacy will be necessary to overcome the challenges of populist nationalism, how we can advance global health amid this cataclysmic pandemic and extend human rights even more robustly into the next generation, both individual rights and also collective rights to health, to life, to a clean environment. We conclude that the future will be determined by the advocates, by those passionate young leaders whose fight for human rights has withstood challenges in the past and who now provide hope for a future of global health with justice and human rights. Yet this is going to be a long struggle. And as we remind our students in the afterword, each of you, all the young people, you have to maintain your own resilience when facing these challenges. We're being bombarded by populist, frankly, bullying leaders. We're seeing loneliness and devastation through the lockdowns and this pandemic. And we've rarely faced the kinds of challenges we do now. You can best take care of the world when you take care of yourself. And that's a message that Ben and I hope that all of you will take to heart. Over the course of your long careers, you'll face enormous struggles, obstacles, and disappointments. But we hope for the future because we believe that you are the next generation. Thank you very much for being here at the launch of our book, the launch of Human Rights Day, and just global solidarity as we all fight together against this horrid global pandemic. One day we will all be back, we'll all be social, and we'll all be fighting for human rights, not just remotely, but there on the streets in every capital of the world and in all the rural areas. Thank you very much.
Thank you, Larry, for your support for students in this textbook and support for students throughout their careers. These chapters that we've developed with our contributors who you've seen so many of today reflect the groundbreaking expansion of scholarship at the intersection of global health and human rights, highlighting the successes of human rights, the challenges of the 21st century in this pandemic, and the resilience, as Larry said, of our human rights advocates. With this text providing a foundation for the next generation of leaders. Yet these remain uncertain times amidst an unprecedented pandemic, and it's unclear whether we will succeed in saving human rights for the succeeding generations. It is with the next generation that the fate of global health and human rights lies. Larry and I continuously push on, looking to this next generation, our students, as our light in the darkness, as this candle in the window to light our way home. With great pride in all that our students have accomplished under the most challenging of circumstances this past year, we look to them, and as dedicated in our book, they are that light in the darkness. They are the light ahead. They are our last best hope for this fight for the future of global health and human rights. I join Larry in hoping that this text provides these students throughout the world with a foundation for the fight to come. I hope that they will use this book in their research, in their practice, as they move throughout their careers. I hope that we have given these students the theories, the methods, and the strength to keep pushing ahead. With apologies that we ran out of time in the formal webinar, we didn't anticipate that every single chapter would be reflected here today. I hope to stay online and answer any of the questions in the Q&A. I hope that you will stay in touch with many of these contributing authors as you read their chapters and use their books in your careers. To everyone else, I say thank you. Thank you for so much for being a part of this book launch on Human Rights Day, and best wishes through the challenging days ahead. We look forward to seeing you soon. Thank you.
Are we all clear?
I'm just going to stay online and see if anyone is staying to answer some questions.
Can I leave?
You most certainly can if you have places to run. But thank you so much for your leadership in developing this book and in pulling it out in the midst of this cataclysmic pandemic. These have been the most extraordinary of circumstances.
It certainly is, yeah. Well,
I-
thank you, Ben. It was a great session, really well done. So we'll be in touch later on today.
Perfect. Thank you so much,
Okay.
Larry.
Bye.
And thank you so much to everyone who stayed around. I hope to answer some of these questions in the chat box to the extent that I can. These are very difficult questions sometimes, and I apologize if I've lost some of the contributors in answering some of them. And looking at some of the ones that have been elevated to the top, I begin maybe somewhat helpfully with one of my contributing authors, Therese Murphy, who wants to know what the panelists would emphasize as next steps in that journey, next steps in terms of education. I think we began this book really as an educational resource. I think as you go through the book, you'll see that it was not written to advance the field, but to describe the field. And each chapter is structured very consistently with sections on the past, the present, and the future of that specific subfield, developed by the experts that we feel are best able to speak to that past, present, and future. Each of those sections has a case study to help bring some meat to the bones of the discussion, so to speak, to help to provide clarity on how some of the specific principles apply in practice. And at the end of each chapter, we have a series of questions that have been developed to help students in thinking about what this chapter can mean for their careers. I should also note, as posted in the chat, that we've developed a series of example lectures, PowerPoint slides that can be useful in teaching this course. We've posted them alongside a model syllabus that we feel can be useful for those who are thinking about teaching this course. And we hope that it's helpful in thinking through the next steps. I think that the second question really speaks to some of the reasons why we developed this book. That for many people in the global health space, there is confusion between social justice, health and human rights, and equal access to all. And I think one of the principal goals of Larry's chapter on global health law is to answer the question, why do we need law in this? Why is moral principle not enough? Why is it not enough to talk about social justice? What does a focus on international law add above and beyond the moral imperatives to realize health for all? And I think where we land in that discussion is accountability. That focusing on legal frameworks for human rights, drawing on the international legal system, we provide both political legitimacy with states developing international law, and we provide legal accountability to ensure that where states fail to meet their international legal obligations, that they can be held accountable, whether through advocacy, through monitoring and review, or through litigation, or even, and again, this is my own bias from our previous book, in Human Rights and Global Health, through global health governance. David Patterson, so many of our contributors are putting in questions. Oh, it's not a question. Thank you for that warm thought, and thank you for your wonderful video. In thinking about how we can communicate, this is Jonathan Gray's question, thinking about how we can use the right to health to advocate within medical practice for patients. I think this book was developed in some ways to facilitate that. Our principal focus is in changing policies and programs, but from policies and programs comes the practice of medicine, the practice of public health, the practice of nursing and social work. And so we designed this textbook in a very interdisciplinary way, seeking to reach people across disciplines and trying to help people not just change policies, but to change practices. And you see that focus on practice across a wide range of chapters. I think a lot of it begins in the chapter on the right to health, where John Tobin and Damon Barrett really focus on harm reduction and what harm reduction practices should look like under the right to health. Flavia Bustreo picks this theme up in chapter 4, asking the question, what does non-discrimination and equality mean in medical practice, and speaking as she does as a practicing physician. as we move forward to focus on advocacy, monitoring, litigation. All of these chapters focus on how this can change individual practice. And as we move into the examples throughout the chapter, a wide range of lessons can be learned, from a focus on medical practitioners in reporting infectious disease in chapter 10, to focusing on the ways in which medical practitioners can address issues of obesity without facilitating stigma against those who are obese. This same idea of stigma comes out very loud and clear in focusing in chapter 13 on mental health and disability. As we move forward in sexual and reproductive health and rights, Terry McGovern and Aziza Ahmed focus on the ways in which medical practitioners can address issues of LGBTQIA health as part of their realization of sexual and reproductive health and rights. And as we move into forward-looking challenges, we see all the way into chapter 20 that medical practitioners have a crucial role to play in resisting this populist turn that has in some ways undercut all of our efforts. And so I think that is all of the questions that we have here. Thank you so much for sticking around and being a part of this inspiring launch. This book has been the passion of our lives. Textbooks are not interesting for many people to read. And so we sought to create an engaging textbook that would be useful to students because we care so much about the next generation of this field. What we hope is that we're providing something that can be useful to students throughout their careers, to young practitioners in framing how they can make a difference in this world, and in older practitioners in incorporating human rights into their day-to-day practice. I believe that we've succeeded in that effort. I hope that this is a book that you can use throughout your careers. And I look forward to working with the students, the faculty, and the advocates in the years to come to draw on this textbook as a foundation for the future of the field. Thank you so much for being a part of this. I wish you well in the difficult days to come. And I hope that human rights can provide a foundation for the post-pandemic world that we want to see.